Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. Adam is currently in private practice and serves as a clinical consultant and supervisor for a number of treatment centers.
Just had a really unique experience. I met with not one, but two therapists, Dylan Berkey and Tiffaney Hale, both marriage and family therapists in California. What a fun, dynamic conversation. A lot of good banter and back and forth. At the root of the discussion, we originally set out to talk about a funky topic called the intersection of trauma, addiction, and queer in the queer population, addressing couples issues, which is very wordy and all over the place. But what we really got to was at the core of the work both Dylan and Tiffaney do is a committed value to the relationship. And the relationship for them begins with the professional consultation that they both have. They share an office together. They spend hours a week in dedicated time bouncing things off of each other and creating space to be vulnerable, to make mistakes, and to be real and authentic. And what they really believe is that if they take care of themselves and are able to be authentic, then that translates into the work they do with couples. They introduced a very interesting model of couples work where each of them will meet with a respective partner in the couple. And what they'll do is they'll come together and work together, both therapists in the room, the couple in the room. They'll work collectively to address the couple's issues. We gave a particular focus to the intersection of trauma and addiction in the queer population and how that manifests and surfaces, the type of issues that may surface both for individuals and for couples. That was a big mouthful, but you'll see from listening, it's all rooted in the safety of the authentic relationships that is cultivated in the room with the therapist. So I hope you enjoy. Hi there.
Hi.
We just did that. This is our second time doing that. I'm Adam Silberstein. You guys are my guests. Thank you so much. I have Tiffaney Hale and I have Dylan Berkey here joining me on this podcast, Getting Better with Dr. Adam. And we have an ambitious discussion today. Dylan found this language, which is the intersection of trauma, addiction in queer relationships, right? So that's pretty
something like that.
So that's pretty broad. And I'm sitting here this morning thinking, how am I going to structure it? And it was really interesting to me. I like to speak to people before we start, and and this is the first. There's a first here. There's the first time I have two guests, both licensed marriage and family therapists who work in Eagle Rock, California. And really, it's really interesting before to sort of get to meet people and hear what they're about. I come in like I try to pregame and think about how am I going to structure this. And I knew right away. I started with, well, first let's define what a healthy relationship is, and so let's create some rules of what do the masses say equals healthy relationship, and what was interesting to me in the discussion is they both sat there kind of quiet, but was
we don't like rules very much.
What was very revealing to me was this: is in our work we believe that, and this was the discussion, that we allow people to have an experience in the room, in the office, couples who come in, and in the space of allowing them to go deep and vulnerable, right? They will inherently know for themselves what works, meaning meaning it already told me so much about how you approach things. Is don't come in assigning ideas and rules of what's right.
We don't overlay the rules.
Right. Let that I trust the human experience, connected human experience enough that in the process of allowing people to be intimate and vulnerable in the office as a couple, they will arrive for themselves at what is needed. Is that accurate?
Yeah, we'll find it.
So basically,
we'll find it together.
Basically, my whole game plan was dismissed.
Perfect.
Right?
No.
It's a parallel process.
So the other point of interest that I discovered, and I'll shut up soon. The other point of interest.
I'm not holding my breath.
Okay, meaning you don't count on me being quiet. That's probably that is true. That is a good assumption. I'm also a big interrupter. I'm really working on it. So the other thing that was interesting is Tiffaney and Dylan work together and really, really, really focus a lot on a work relationship where they both share an office, but it's far more than that. They have a very unique professional relationship where they use each other as consultants in a very meaningful way. And as a matter of fact, what I want to touch on is that how they actually do work together with couples where they're both present to help the couple. And some of that work that they do together in terms of professional consultation, how it translates into helping their clients, their patients. So that's the preamble that was a long one, but that's kind of where we want to go. So why don't you guys, one of you can start, just tell us a little bit about the ideas you have around relationship and how you help people.
Well, what we were talking about earlier is how our relationship with one another and consulting together, even when we're not in the room with clients, informs how we are able to show up in the room with clients, because we go deeply into the work together, because we open up spaces that are challenging or uncomfortable together and unpack those. We're more able to show up fully with our clients, which in turn invites them to show up fully.
So if someone's listening who knows nothing about what we all do, right? Or also doesn't have a background in a more depth-oriented type of approach, what do you mean that when you say that you go deeply together in a consultative way, what do you mean by that?
I mean, I can say for me that I have zero fear in talking with Tiffaney about cases, about my own experience in the room with clients. We've developed over time a lot of trust, and so I can easily come to you with my discomfort or fear or
oh my
having
God,
made a mistake.
That's it. Oh my God, I made a mistake. Yeah. Right.
And so can you give me an example of the type of thing? Because this is really, I would imagine that some of the listeners that we're sort of attracting are people who are interested in the field or new to the field. And this is, in many schools of thought, not a primary focus. Right?
Yeah.
The unpacking of the discussion or the consultative experience is not as essential, I should say. It's more about what do I do, see you later, right?
Okay.
Definitely.
Right? But what you guys are talking about
It's very
is
foregrounded.
right, is the an essential ingredient, like that in terms of how you help people. So
just like our own therapeutic work. I mean, being in therapy is important for me. Yeah. And doing my own work, consultation is sort of another piece of that.
So tell me the type of thing an example of the type of thing that you would go to one another for in a helpful way.
Well, we hold space every week. So we go to lunch together once a week. We spend
few hours,
several hours together, and it's pretty unstructured. We share a meal and talk about sort of where various cases are and where we are.
I think even more like where we are with our respective work. If we're working together with people, we'll talk about what's happening there.
So where we are, meaning not where we are, what's going on with me, in this case, the clinician, what's going on with me in regard to my work with that particular client, meaning am I bothered? Am I bored?
Yes.
Am I
Yes.
right?
Yes.
So
we both came out of a training program that was psychoanalytically grounded, that was contemporary relational psychoanalysis based.
Right.
And so we were both trained that way really from the beginning and learned, I think, early on the value of a real vulnerable consultation.
Right. So for those listening, you could say, what's the treatment plan? You could say, what interventions should I use? Meaning in other modalities and other types of approaches, you can talk about what's the diagnosis. You can talk about those things. And I'm sure you may talk about
we
those things.
can talk about those things,
Right.
and we do talk about those things when they feel useful and interesting,
And
right?
when they're clarifying. Yeah.
And the stuff that I would say we generally find sort of more juicy and inspiring is about the relationships.
Right. How do you feel in the room?
Yeah.
What's happening? What's getting blocked? What's getting opened up? What's going too fast? Where is it stagnating? Those kinds of questions.
So how
Where
do
am I
you-
holding back?
Yeah.
Right. How do you, right? Why am I afraid to say something? Why am I uncomfortable? Why am I walking on eggshells in certain situations?
Why am I sleepy?
Why am I sleepy? And what's going on with me personally that might be impacting this? Right. So that's something we can kind of unpack together as well. Like, remember, you haven't had a sleep in a week. So let's look at how that is showing up in the room or whatever.
So it's two peers. It's not a mentor-mentee.
No.
It's and this is, and I've been doing this for a long time, right?
Yeah.
And I don't see this too much. So
okay.
it's getting my attention.
Oh, great.
Right?
Yeah.
It's getting my attention. Two peers, not one. Both went to school at the same time, right? Both graduated around the same time. Same
Yep.
school, right?
Same school.
Same
Graduated
school,
at the
same
time.
everything.
Different cohorts, but yeah. Same.
You didn't hang
the
with
same
each other?
school. No,
No.
we didn't. We didn't hardly know each other at all,
Oh, okay.
actually.
But the similarity.
But we were
and
trained similarly, and we
that shows up.
very much so. I think that we have had similar clinical trajectories in a way in terms of
We did different things since grad school, but it's all informed by that starting place.
So I set aside this time. We come together later on in our careers, but as peers. We share an office space for the last 8 years. We set aside several hours a week for each other, right?
Yeah.
To both hold this space where we get to talk about A to Z about what's going on with us, including if we're looking at the clock all the time,
Yeah.
including if we're, I like that word, sleepy, all the things that people would apologize or would be embarrassed to say.
Yeah.
Yes.
Right? If they
Very
were
much so.
like, is it true that you're looking at the clock? Is it true that
Yeah.
you're like, thinking about your bank account? Is it true that you're thinking about when the week is going to be over? Right? All these things, right?
All the taboo things.
All the taboo things,
Yeah.
you both have the courage to say to each other, yeah, I'm wondering, why did I ever do this? Why did I take this case? What was I thinking?
Oh, yeah.
All the stuff
Absolutely.
that can come up. So now I like that and encourage it. So what happens? How does this is the thing you're highlighting. Here we have this discussion, the intersection of trauma, addiction, and the queer community in terms of how it shows up in relationships. How does this relationship, right? The Tiffaney-Dylan relationship, how does it inform this discussion that we're having?
Yeah. I think that we were talking about this a little bit in the car. I think that it, I experience a certain kind of freedom when we talk, and I then bring that freedom into my work. I bring it back into my work. And so I think that our relationship allows me to hold all of the relationships in the room so much better. And I think we have some we have, again, some different clinical experience that is very similarly informed. So we fill in some gaps with each other too. Like, I have much more experience with addiction, right? You have more specific experience with trauma at the Trauma Institute. So, yeah, I mean, you certainly work with people with addiction. I certainly work with people with trauma.
Well,
but
and that's probably when it looks more
we help
like
each other.
consultation that you would expect.
Yeah.
When I get a tangle around an addiction issue, I go, oh my gosh, I'm in over my head here. Dylan, help. Right.
So that is a part of it. But what I'm hearing from both of you is that that's cool. It's nice that Dylan has that experience and I can go there. But the most inspiring aspect of this connection is the part where you get to be as authentic as you can be
With each other.
with each other.
Yes.
with each other and then with everyone
And
we
that
work
translates.
with.
Yes, it
so,
does.
So I kind of caught you having an ingredient of what a healthy relationship is, which is the ability to be authentic in front of another person.
Yeah.
Right?
Sure.
Did you agree that
Yes, yes.
that is a kind of linear, right?
It's a value that I hold.
Right. It's so. Do you hold that value, Tiffany?
Yes, I'll accept it as a rule.
So I even say that, right, that there is a goal, right, and more of a point A to point B to point C. There is a goal, and the goal is to the extent that I'm able to be fully real and vulnerable, I will be able to help people, and then and in that space, I'm guessing the individuals who come for help will also be exposed and encouraged in their own way to have the experience of connection and authenticity, right?
Yeah.
Built in relationship, right?
Yeah.
And it starts with the two of you, and I would imagine also expands to other relationships in your life.
Oh,
Right.
absolutely.
I would hope so, yeah. Yeah.
Sure. I mean, I think that the other relationships in our lives probably inform this one too.
So
Yeah.
treatment plan is anti-phony.
Right.
Right. So if we're using that language, right, the treatment plan is for starters, I can't be a phony, and it starts with me, even before
Very
the
much
patient.
so.
Right.
Oh, very, very much
Right.
so.
Right.
There's no way I would ever expect somebody to be vulnerable if I can't show up with vulnerability.
Right. And
At all.
and it's interesting. I've come across people in our field who have a shame around their own work, meaning like,
Right.
I'm in therapy, don't tell anybody. And you guys are like, well, yeah, I'm in therapy, of course.
Of
You know,
course.
like of
Of
course.
course.
Well, because
like,
without
unapologetic.
that, I don't know how I would discern what parts of myself are appropriate to bring into the room with my clients. If I couldn't unpack it with Dylan, I unpack as much as I am aware of with Dylan, and then that gives me a lot more choice about what I expose in the room or not. Right?
More consciousness.
More
yeah.
consciousness, right? It's not that I show up in the room and just blah.
No, but that
Right?
includes
It's
not just
careful.
Dylan, but you're also your own work, meaning your
Of
own
course.
individual therapy. It's such a given, and it's such a given
Yeah.
in the school of thought, right? That you're from. It's such a given. It's unapologetic.
Yeah.
Oh,
And
absolutely.
it's kind of weird if you don't do it.
Yes.
I feel worried if somebody's not doing it and is seeing clients.
So you're to it's not something, and it's not a graduation.
No.
Right?
No, it's ongoing.
It's ongoing. Is
No,
that
it's evolving.
just out of curiosity? Is that your stance for professionals, or is that your stance for the general public as well? Evolving treatment, just be a person who's endlessly in therapy, or is it more targeted?
More targeted. I mean, I think if you're doing this kind of clinical work, it's tapping something in ourselves that requires attention all the time, right? To keep things organized in a way that is focused on the patient in the room, we have to know what's going on with ourselves.
So you have to have the ability to discern that. Otherwise, you bring your bullshit in the
Yes,
room,
yes,
Absolutely.
yes.
right? And
Yeah.
and people can get hurt
Yes.
because you're and not that you're perfectionist, but the willingness to look at that helps preserve the sanctity of the therapeutic
Absolutely, because
relationship.
the kind of work we're doing is relational, right? It relies on my relationship with my patient. So I have to take care of myself outside of the room to be able to show up and not use the patient to my end emotionally.
So for someone who's never heard the kind of work we do is relational, does that mean that you like high five? Like what? like what? Like what is?
We
what
have coffee together.
What is?
No,
What
I
is?
didn't mean that.
Like that sounds like do you? What is relational?
It means I am open to talking about what's going on between myself and my client patient.
I would even say that it centers. It
Yeah.
centers the therapeutic relationship
So
as a starting point,
As
as a starting point, and as a holding environment, and as a microcosm.
Mm-hmm.
So I come in, I hate my partner. I'm so resentful.
Mm-hmm.
I'm so resentful at my partner. My partner is just beyond disappointing.
Mm-hmm.
Why doesn't he or she do X, Y, and Z? Why does she speak that way? Why does she have that accent? Why is she perky? Whatever is potentially bothering. How would that relate? What the relational piece between me, patient, and therapist? How does that get exposed?
I might listen to how I might be a bother to that patient, right? What's annoying about me, and depending on how open the patient is to talking about it, I might say, "Oh no, what happens when my tone of voice is really bothersome? I hope you can tell me. I hope we can talk about it. I hope we can unpack that so that you."
What
then
if I
can
get
have,
perky? What if Tiffaney gets perky?
Yes.
That would
Yeah.
be terrible,
It,
right?
It,
But
it
then-
doesn't
but if-
happen. It rarely happens.
But
It rarely happens. It's true.
So that becomes the material.
She's a calming influence.
You're too calm. You're too calm.
I
So
do
what-
get this feedback sometimes.
You do?
Yeah.
So just
I don't.
Just for fun, can you give two examples of the type of feedback you get? Like
Mm-hmm.
that's because you're trying to draw this thing.
Right.
How is the connection to me, right? So what is the type of feedback you get?
One is that I can be I can allow a lot of room in. I don't tell people what to do. I don't give them a pathway. I don't give them homework, right? And so for some people, that's really anxiety.
Triggering.
Frustrating.
Yeah, it's
Yes.
really anxiety
Frustrating
producing.
sometimes.
Mhm.
So they'll say, "Why aren't you? I'm here. I'm paying you. Why aren't you giving me direction?"
Right. And then for some people, it becomes kind of something we can laugh about later. Like, tell me what to do. Well, I don't tell you what to do. So now what? Right. But for some people, it's really frustrating.
Yes.
And for some people, it's very freeing.
And for some people, it's very freeing.
Dylan, what about you?
I have gotten a lot of feedback from people saying that they enjoy that I am more interactive than they've had in other therapy experiences.
That just made you look really good. I just want to say,
No, like that I will come.
Tiffany had the courage to
But
say,
it's
"I'm
not.
non-directive."
It's not. It's not good for everybody.
Yeah.
It's good for some people.
Okay.
Right. It's definitely not good for everybody.
Okay.
Um.
So there's more banter. There's more back and
Yes,
forth.
There's more, there's more, I would say, kind of collaborative participation.
Okay.
And I also have noticed, we were talking about this too, I've noticed that over the time I've been practicing, that has changed and grown.
Mm-hmm.
I'm more comfortable. Like I'm just, I trust my experience. I'm not afraid of slipping or doing something wrong.
Mm-hmm.
Mm-hmm.
And that for me is also part of relational work, right? Like if I fuck up or make a mistake or do something that somebody doesn't like, then we get to talk about it.
Do you ever get like, what's that face you just made? Do you ever get stuff like that?
Yeah. Definitely. I have a very expressive face. I do.
Right. So like, what was that? Like, what kind of face did you just make at me?
Yeah.
And if let's say that somebody's telling you something that's just, ugh,
Yeah.
right? Like it's gross.
Yeah.
Do you?
You just do
and-
that. Ugh.
And you make that face,
I
and
go-
you were wrong. You're kind of being judged. Let's say you were being judgy.
Yeah.
Yeah.
Does that get exposed? Do you say, "Yeah, I was being judgy"? Or
Yes.
So you can. It's in this
Particularly
relational,
if the relationship has grown to such a
Yeah.
place that they're comfortable saying so.
That's the idea. I mean, that's the hope with
so you get
relational
to
work.
be human too,
Mhm.
and drawing people. You don't have to
Definitely.
hold yourself to this standard of I have to be perfect. If I make an ach face, right? And translation is like what's the translation of ach face? If like a how would we say that? It's just
Judgmental
a
or
judgy
something.
face, right? Like that, a critical, bothersome
Like a
face.
disapproving
A
face?
disapproving face.
Okay.
You get to say, yeah, I did.
Yes.
I don't love hearing how you're comfortable doing the X, Y, and Z, right?
Absolutely.
So what I'm drawing from this, and it's the anchor of our discussion, so much of this is forget about techniques, forget about homework, forget about changing your thinking or exercise plans. Not that you're anti that, but the
Right.
centerpiece
Right. Not at all.
of the work is going to start with what's going on between us as it draws out this primary goal of authenticity, right?
And sometimes it's more explicit and sometimes it's less explicit.
Right.
Right?
Depending
Like,
on the
I'm
need of the
holding
client.
it. You're holding it, right? And sometimes it comes explicitly into the room when people are into it, right? Like some people really enjoy making conscious the relationship in the room.
It's illuminating.
Yeah.
For
It's
some people.
illuminating. But let's say now let's draw it back here. So trauma, addiction, queer population, right? That's just so much, and in the context of a couple, right?
Right.
And in the context of a couple, there's like there's an endless amount of activity just in those
Yes.
words in terms of what so when someone comes in and is suffering so much, right? It's all good and well if you're having a discussion with someone who is probably functioning at a high level. But if someone comes in active addiction or like, in the throes of PTSD, and you're saying, not only am I going to work with you, I'm working with you as a couple, right?
Right.
Or
Yeah.
you
Right.
both are crazy.
Right. There have also, I would say that there have been times that each of us have met with a couple and assessed that they're not ready to meet as a couple.
Right.
Right? That sometimes happens.
So in the context of our discussion, right, when they come in as a couple, right, and we're going to get to this, my favorite part of what you do soon, but when they come in as a couple and they, there's all this energy, right? There's energy.
lot
It's,
of
you
energy.
Tiffany talked about, what discerning, what's mine, what's not mine, and all that. Meaning, what happens in a room when there's zero ability to discern anything? All you are is you're a receptacle of misguided energies, right?
Well, it's like any kind of intensive trauma treatment. It needs to be phase oriented. It needs to be scalable based on the stability of the patient, right? So if somebody comes in overflowing, then the first step is calming things down, stabilizing, regulation,
Not
all
to
of that.
stir a bunch of stuff up.
Right.
So you guys
Right.
aren't just saying, "Hey, come on in, we'll do this funky couples work."
Unpack
No,
everything.
no.
No.
So-
Right. And especially with couples, it's about regulating the interactions between them, being authentic, yes, but also being safe and reasonable with one another, not kicking everything up all the time at home or in the room.
Right.
So it's not, for the listener, it's not, hey, bring them in right away. It's much more of a process, phase oriented. And the idea would be when someone is in couples work, right, that couple is ready. There's a readiness that you've assessed and developed over time that they're ready to have those types of discussions in the context of a couple. Right.
Yeah.
And
Couples work is so intense.
It's really intense.
Really
I've
hard.
also definitely worked with couples where it becomes clear that it's too flooding.
So so it could be that many months or even years could be spent in preparation. So in terms of the context
absolutely.
of the queer population, right, and trauma and perhaps addiction, right, what are the typical issues that surface? Meaning, what are you seeing out there? Because it seems like a real sort of niche focus, right? It's not Or I'm wrong, and it's just the people who come to you,
Well,
right? It's just
it's maybe both.
Maybe both, yeah.
So what are you seeing? What are you noticing in practice in terms of what are the particular issues in that population that you work with that you're seeing?
Okay, so you were laughing about me talking about the intersections, but that is the
I just like
biggest,
the funky, it's a really good title. I
That
don't know if
is-
it makes sense, but it's really good. Yeah.
that is the biggest thing I see is how trauma intersects with how queerness is received
Right.
by the world.
Right.
Uh-huh.
And then how addiction can come into, as an attempted solution.
Can you tell me what you mean? Start in the beginning with trauma and the experience of identifying.
Yeah, I think a lot of queer people, not all queer people clearly, but a lot of queer people have early experience either in family of origin, in school, in just the larger world of feeling unwelcome or, marginalized or oppressed or abused,
Being in hostile
continuum.
social situations, right?
So, just out of curiosity, are you finding that with more an older population? Is the younger population different, and is it more? Is it easier in a certain way?
In a certain way, yes. I think it is easier in a certain way. It's interesting. It's something I think about a lot.
It's also different based on geography.
Right.
Definitely.
Like
Los Angeles, California is
That's
very
right.
different than
I
Houston,
worked
Texas.
in Houston and then
Yep.
here, and the presenting issues are
Very
different.
different.
Yeah.
So,
based on class
Yeah,
background,
yeah.
based on all kinds of things, based on access to culture. I mean, all,
so 50-year-old woman from Alabama, right, comes in marginalized, history of being marginalized. So the trauma is definitely connected to that experience of hiding and so forth, right? So that's that piece, right? And
then that person is more vulnerable to other kind of more what we think of as interpersonal trauma throughout the course of life.
so what do you mean by interpersonal trauma?
that they're recreating these originary harmful relationships often.
In many relationships,
Yeah.
right? So they just sort of recycle themselves in, ultimately, I'm going to be marginalized. I have a belief I'm going to be marginalized. I have conviction around that, and it shows up in a sense of I don't feel a part of. I feel less than. I'm angry at the other individual,
Right.
And
then reinforced by social reality. Right.
reinforced by social reality, but also at its root is the core sexuality issue that was that core issue that was punctuated by true experience, right? Not fake experience, right? And I'm
Very,
sorry,
very real
sorry,
experience.
Alabama, and I just came out. I don't know. I just want to say qualify. I've never been there, and I don't. It may be the most welcoming experience for a 50-year-old growing who reflecting on her childhood experiences. But my assumption is there also could be an element of a lot of pain and hiding. So again, and what was interesting what you said and how addiction plays in is it becomes the way to actually cope with the pain, right? So I'm in a relationship, right? So I'm an individual. I come to see you, and this is we're getting to my favorite part, and I go through this period of I'll use Dylan. I'm working with Dylan. I'm this. I'm married, and it happens to be that Tiffaney is working with my partner, right? And so Dylan's working with me. I'm married, and I have these issues, and we spend a lot of time exposing and creating this vulnerable, safe environment for me to examine my relationship with you in the context of trauma, sexuality, and coping mechanisms, right? And I start to feel safe, right? And I start to gain awareness, and I think I'm hearing you guys say that ultimately there's a trust in the human experience that the information will come in this safe relationship.
Yes.
Right? Is that accurate?
Yes.
So tell me. So what really caught my attention when I spoke to you originally, Dylan, was that what will happen eventually is you potentially, right, could work together, two therapists, two separate patients come in a room in a form of couples counseling,
Mhm.
right? Like, so how would take me this situation? I come to you, partner goes to Tiffany. How would it play out in terms of working together in this way?
Yeah. I mean, we started doing it out of consultation. Like we would be consulting about patients and basically sort of recognize that we were both each holding one person and we're holding them together already. And
What do you were consulting with each other,
mhm.
and you're holding one person, but you're holding them together because of your consultation? Interesting.
Right.
Yeah. And so
And a need for couples therapy comes up often when you're working with an individual. And sometimes we've talked about it and thought, no, that would be too intense of a model for this particular couple. We're going to refer them out
For a separate
for a separate kind of more traditional structure. But if it seems like how do we actually assess it? It's hard to say, but because
I think if people feel, if we notice and trust that the people are capable of being in the room together and of it being generative and
right,
collaborative.
it's a more intense model, right? Because my patient is going to have a lot of feelings about Dylan, their partner's therapist, and vice versa. And then all those feelings end up in the room, right? And it's just 4 minds and bodies in the room, which generates
More energy.
So it moves a little faster than the usual model of couples therapy, I find. And it's just a little more intense. But the benefit is then you have the individual work to process what happened.
Oh,
right?
interesting.
And
They
so
work
that
together really
helps.
well.
That really helps. So wait, what did you hear in that last couple session? Oh, that's not exactly what I heard. Let's look at that a little closer. And it helps. It sort of moves it along more smoothly. It's a nice model.
Yeah. I also think that each person coming in then sort of gets to have their therapist, right? With them.
In the room with them,
So
right.
each person gets to feel held and more safe going into sometimes difficult conversations.
Do you feel protective of your individual patients in that type of experience?
Of course.
A little bit, yes,
Yeah.
for sure.
Not
And also
not protective in a way where I don't want difficult stuff to come
Right?
up.
Are you ever?
Yeah.
Are you ever like, Tiffany? What the hell?
don't be so mean to
Yeah.
No.
Why were you comfortable saying that? What? How could you?
That
What were
hasn't
you
happened.
thinking?
That has not happened.
No.
I mean, I think it might even be the opposite, where it's possible to nudge just a little bit into some hard places because we know where they can go.
Mm-hmm.
From
And
the
we
individual
trust
work.
each other a lot, right? Like there's something about both of us being in the room for a therapeutic encounter that for me makes me probably more present and
Energized.
brave.
Energized,
I think.
yeah, that's a good
Yeah.
word for it, right?
Energized.
Yeah,
when you're-
energized.
Well, and if something happens that feels off to me in the room, even with a couple, part of what happens is a modeling where
Yeah,
I
we
might
can talk
say,
about it.
no, Dylan, that's not exactly how I see it. I think it's more like this. We
right
can
in front of the couple.
Yeah,
Mhm.
yeah.
Right. So I'm trying to be a fly on the wall, right, and sort of envision. Even before that, you're doing, and this is really the heart of what we're talking about. It's so interesting. Both of you, the anchor of this is your relationship as two professionals, good friends too, right?
Yes, I was
and good friends,
definitely
and
very much so.
and extreme trust, right?
Yes.
And you walk in, and part of this, it just feels right. You know, the couple can tolerate being in the room with each other, and this could be a beneficial experience where you have the other person's therapist, but it also can be a charged experience. It's guaranteed to be a charged experience because,
Yeah.
right?
I think that's right.
So I'm a fly on the wall, and like one of you. So welcome to this model? How would it unfold?
We would have each talked with our respective patients about it and established that everyone is on board to do it. So
It seems like often patients are really into the idea.
Yeah.
There's something really comforting
Right.
about couples therapy where the therapist they know and are comfortable with is
And
going
also
to
maybe
be
they
there.
feel more the potential to be heard.
Yes.
Meaning like this person, I want to be right. I want to be right. Dylan's going to know, my partner so well that I have a chance of being more right. And I should recruit Dylan
Right.
into help me to prove my point, why my partner sucks. Right?
Sure. I mean, I'm thinking about one couple that we worked with, and I don't, and hard things came up, and I didn't actually feel that happening, like recruiting for sides.
No.
It almost makes more space to hear the other person. It feels like,
right,
to me.
Right. It's like the kind of trying, like what happens in a usual model where sometimes it feels like each part of the couple is trying to get your buy-in or get right.
Win you over.
That gets broken
It's
down
reduced.
a little bit here.
I agree.
So like it loses the referee experience.
It does.
Yeah.
Right. And like, I'm going to, it loses the selling part of it. I'm going to sell my part.
Especially
sell my
because
truth.
we're not a single voice.
Right.
Like the way that we talk in the room is we don't agree all the time.
No, and it's
And you
interesting.
disagree and you get to disagree in front of the couple.
Totally. We get to disagree in front of people and have it be totally fine and part of it. Right? Like it's not scary. It's
not a fight.
It's not a problem.
It's a discussion.
It's
here's
generative.
Here's
It's
another way to
exciting.
look at it.
So it could be very illuminating to watch. And the modeling, right? I'm going to go a little behavioral, right? It could be illuminating to watch and model how two adults are having disagreement, how two adults can have discussion, right?
Yeah.
And also do a back and forth of how you may verbalize or present something, right?
Yeah.
Right? And everybody's watching,
Mm-hmm.
right? Everybody's watching.
Right.
So you get to model and you don't, and it's sort of, it's not a referee experience, which I think is cool. Very cool. So do you each, is everybody addressing everybody? So like, are you addressing your patient more versus the other patient, or everybody's equally addressing?
Yeah.
Right. And it's, so how,
Which is interesting, right? Because we have established relationships and then new relationships in the room.
Right.
So when you are all addressing and doing those things that we were talking about earlier, is the same stuff coming out like, hey, what do I trigger in you? Does that come out in couples work too?
Sure.
Yeah. I mean, it's not quite as, I think me as the therapist is not quite as, I'm not processing something that happened between me and your patient, for example.
Right.
That doesn't really happen, right? And just like in couples therapy in general, there's so much happening with the patient that the relational stuff, the intent, like any kind of enactment or something is a little less
With the therapist.
with the therapist. Yeah.
Can you give us an example of, and obviously protecting people's information, an example of a case where you both were just like, oh my God, that was so cool. This is great. This is so helpful.
Yeah.
The theme is getting better here. So what would be like, and in speaking to Dylan before, I'm not going to label what getting better is.
Right.
Yes.
I mean, there's outcome is not necessarily, it doesn't mean we lived happily ever after, but what does it mean? What's an example of
I think the best example that's coming to my mind ended in breakup.
Yes.
Ended
Absolutely.
in a breakup.
Definitely. We're
Can you,
thinking the
so
same one.
what came alive in a case like that?
I think in a way, sort of which I always like having in the room for couples, that there's choice and that there's freedom, right? Like that getting better doesn't equal staying together necessarily. That the project, right, is to find ways of communicating to find truth and clarity and to make more grounded decisions rather than distressed decisions
or fantasy-based decisions when it comes to couples, right?
What would be a fantasy?
Well, I mean, we all wish our partners were different in some way, right? And sometimes you show up at couples therapy to push that, to please help. Let's fix
address
this
our
guy.
buyer's remorse.
Right. And so
to recruit the therapist to change the other person.
Yeah, right. And so sometimes moving from a place of that fantasy to a more, this is who this person actually is, right? It can be very freeing and so sweet when you get a sense of the depth that allows. Right, to move from fantasy to a more intimacy.
It's very forgiving. It could invite a lot of forgiveness and compassion.
A lot of compassion.
And then
I think,
the other side would be, and I too, the one who's been judgy.
Yes.
Right.
Yes.
I'm not the picture of what my partner wanted either.
Right.
Yeah.
Right.
And there's something about the model of us all being in the room, I think, that affords more witnessing than with one therapist, right? So when there's more witnessing, I think there's more ability for each person then to see what's happening.
It's like
you know, you guys should be writing this up, right? You know, right? You know that you should be writing about this. I mean, it's just
we should be writing.
I mean, I'm more directive, so I'll tell you.
Thank you.
Right? So I'm not asking your opinion. I'm just telling you. I'm giving you a should. I'm giving you a big should.
It is a nice model. It is.
So I have a question. So let's say there's intimacy. Let's say somebody has a real hard time being vulnerable and saying and gets uncomfortable and just has a hard time verbalizing and expressing from an emotional place is more logical. I'm sure that you see that. How does all these witnesses, like you say, I love that. There's so many witnesses. How does that come alive in these sessions? I mean, how do you expose it?
I mean, I think just like any other personality structure or way of being, it's finding some room for it, right? Somebody who is more logical or more constricted emotionally, that's just where they are.
Or guarded.
Right? So this model can be overwhelming, and so it has to be assessed. But if we can find a way, part of it is we're not going to push you to be more emotionally open than you're comfortable with. Nobody gets pushed to be different than they are.
So point of clarification to people listening is that the as much as authenticity is an essential ingredient, safety is an equal.
Yes.
Is an
Of
equal.
course.
Yes.
So that you're not going to be, if someone comes to you, they're not going to be told they're not
Thrown
going to be
into the
forced.
deep end.
There's no
No.
forcing. There's no
No.
forcing of any
No,
kind.
no.
But then again, you could say, I do notice how this seems to be making you super uncomfortable.
Absolutely. Plus, if we're using this model, then we each have built a trusting relationship already with our respective patients and know them and can call upon that, right? Like I can say in the room, you seem much more guarded when we're all here together than I usually experience you.
Could you even say it's so interesting to me? I would say it's so interesting to me. Would you throw it out that way or just say you seem more guarded?
You would say it just like that.
Yeah, I think I would say it just like that.
Just you seem more guarded.
Yeah.
You seem more guarded. And then the process, right? Not the great wisdom of my ideas about it, right? But the process itself unfolds.
Right.
Yeah.
Right. And it's gonna and this is in a day and age of managed care, right? With very, very, very much evidence-based outcome. They're going to be saying, what in essence are you doing?
Absolutely.
Right?
Sure.
In that model, in the model in the medical model, in the evidence-based, and I'm not saying that this doesn't have room for evidence-based, but the process is so idiosyncratic.
Sure.
Right?
We're definitely aware that we work from a very particular way, right? And that it's in the current climate a little rogue.
Right. So you all, it's a little rogue. Well, it's OG.
Maybe.
It is. It's kind of.
It's OG and rogue.
Yeah, I mean, it's kind of old school cool, but
it's ROG.
Yes, that's right. So it is, but I would imagine that there's also what I'm hearing is there's a lot of uncertainty. Meaning,
Oh, yes.
so
that's actually the central part of it.
That's exactly it.
What do you mean?
I mean, if we don't know where we're going exactly, we don't know exactly what's going to come up, that means we're showing up for what does. Right? We're not directing the process, we're in the process.
And you have to, as the therapist, and this goes back to the work you do. And it's interesting in this discussion, because I'm so goal-oriented, the intersection of trauma, addiction, and
it's not even
queer
what's happening,
issues,
huh?
right? No, but it's kind of irrelevant in a certain way.
Yeah.
In a certain way
Or it's
to the
very
discussion.
background.
Right? It's very background. Each couple, right, is a unit, right? And that unit is going to be its own expression, right? It's great to know and to have a sense of competency in culture and in trauma training and all those
we have
things.
those, and we go to conferences.
That's why
we read.
That's I think why we're able to kind of show up more relaxed.
Yeah,
right? Like,
you got all that, but
Yeah.
in essence, it's also going to unfold out as it's going to unfold
completely.
And no two situations are going to look identical.
Oh no, it's not possible.
Never.
Right? It's because each unit is what's a nicer way of saying a couple?
Like a dyad.
Each dyad, better, thank you. Each
Or
dyad
triad.
or triad. What would your triad be?
Or quadrad.
You do you have triads?
Yeah.
Okay. Yes. You're open. So for the purpose of this discussion, we're talking about 2, but it could be 3 or 4.
Sure.
In your offices, right? So that's totally possible. Any type of relationship, right? Right. You're open to anything. This is your niche, right? Meaning this is what you guys do, but saying this is what I do is kind of missing the point because every case is
no, it's really
every
about
case
this is how we do it.
That's it.
Yeah.
Because we were talking about this before. I don't know exactly how to say what I do, but we're getting at it a little bit. It's how.
Right, but it's the process of the uncertainty and how it unfolds and what's going to unfold, and a deep trust.
Yeah.
A deep trust that connected and authentic is right.
Yeah, and so when you were asking about what we need to do as individual work to be able to show up for it, the uncertainty is a really important piece. Like, I have done tons and tons and tons of work around getting more and more comfortable with the truth of uncertainty, right? So I can show up holding that.
Holding that means I could be scared.
Yeah.
I could be.
Sure.
I can be.
I can be scared, and I can also trust that it's just true that things are uncertain. And so I don't have to be anxious about it.
And you don't have to know an answer. You don't have to know this couple belongs together. This couple does not belong together.
Right.
Or whatever. They should do XYZ. You don't know.
No,
Right.
I hope they surprise
So
me.
I'm in a sea of studying outcomes, right?
Right.
This is the anti-outcome, right? This is
That's right.
It's the focus on the process, definitely.
It's not about outcome studies, right? It's about trusting the experience.
Yeah.
And so you use the word trust. How do you cultivate trust in yourselves in general? Meaning this issue of uncertainty. Yeah, I have no idea what's going to happen tomorrow, right? Transition sucks, right? Everything, it's scary. How do you, outside of experience and practice, right? How does one develop trust?
In other people, in yourself?
In yourself.
In
Meaning
yourself.
you guys are
Yeah.
you are the beginning anchor, right? And if you're not trusting the therapy, I think what I'm hearing indirectly is that I have to do my own stuff, do my own work for this to work. So how do you, because
Absolutely.
otherwise I'm going to put out my fear in the room.
Right.
So how do you build trust?
I mean, I think part of it is the consulting relationship. That's a piece of it. So that when lose your footing, which inevitably happens, right? Some days you go, I am a fraud. I can't believe anyone pays me for this. What is this, a joke, right? And when that happens, then we get to go, oh, Dylan will say, listen, you do really good work. Here's what we've been talking about. Here's what I see in your work. And I go, okay, right.
And sometimes that happens explicitly, and sometimes that's internalized.
That's right.
Also, like we have worked together enough where I can bring you into the room whether you're there or not.
Right. That's right.
Right. And you can also make a mistake, I would imagine.
All the time.
And get honest feedback from Tiffaney saying, hey, I wouldn't have done that.
That's the most fun for me.
And then you can go, I hate making mistakes.
And here's
the most
other
fun
thing,
for me is when that happens. When
it
we
is
get
the
to
most
talk about
fun.
that.
And when you feel, the thing about like feeling like a fraud is one end of the spectrum. The other end of the spectrum is like a narcissistic certainty.
Yeah, it's like being cocky.
Right?
Yeah,
and when I'm feeling like, oh, I know exactly how to handle this, then Dylan will go, well, maybe.
Get over yourself. Right?
Right.
Get over yourself.
Mm-hmm.
And so through bringing it back, and we'll land here, through this relationship, this professional relationship that requires consistency and discipline and development, right? You've built this environment where you are supportive and honest with each other. And in that's part of the job of a professional, right? It's not just cute, right? It's actually our job.
Yes.
Right? It's more than that. It's part of your work week. It's an essential.
Oh,
It's an
absolutely.
essential.
It's an essential, and it gives you the support and the trust, right? That you're on the right path.
Yeah.
Very, very interesting.
Yeah. And I mean, for me too, like you were asking about uncertainty, right? Like I've spent years and years and years and years and years being really interested in uncertainty. Through my own recovery, through my own therapy, through my own meditation practices, right? Like it's something that's really interesting and important to me. So it's something I need to spend time on. And if I don't, I feel it. And I don't.
Meaning that as someone having a human experience, part of what I need to do is address this human thing, which is nothing I can do could create certainty. Right? There's nobody who has absolute certainty. And this is just an ongoing, if I know that, right? And I just have to be busy tending to that.
Right. I can't change that uncertainty is true. Right. I can change my relationship to uncertainty.
Your comfort level.
Right. But that's the requirement. It's an ongoing job. And part of that job is the work the two of you do together and the dependent of each other. Thank you. That was so illuminating. It was so, for those who are new to this, right? This is no matter what school of thought you're interested in, right? I just think it's the ability to be raw and the ability to just have a safe place to say everything, right?
Yeah.
About what I'm going through as a clinician, right?
It's invaluable.
From arrogance, I've heard arrogance. I've heard fraud. I've heard so much.
Yeah.
Right. I've heard bored. I've heard sleepy. I've heard so many words that that you're so comfortable saying.
Yeah.
Right?
Or like I cannot believe that I actually just said that.
Right. Totally. Right. I once had a supervisor to say, he said, barring extremes, we learn boundaries by breaking boundaries.
Yes.
So it really helped me cope with mistakes myself.
Yeah.
So now that we know all this, how do we reach, if someone wants to have this experience, either couples work or individual work, how do they reach Tiffaney and Dylan?
I have a website, tiffaneyhale.com, and an email address that's there and a phone number that's there.
So tiffaneyhale.com, right? Can you spell that? I mean, just for the purpose of it.
It is spelled a little weird. TIFFANEYHALE.com.
So that's for tiffaneyhale.com.
I also have a website. It's dylanberkeymft.com. DYLANBERKEYMFT.com. And all of my contact information is on there.
and they can read, people can read and sort of hear about some of your interests, other interests. We just touched on the relationship, but I would imagine, and I know based on reading about you guys and speaking to you, you do so much more than this. So what a fun conversation.
It's great. Thanks for having us.
Yeah.
I love this. This is just my fun. I do this. This is one of my favorite things to do now.
Well, it's one of our favorite things to do.
Who knew?
Not generally with microphones, but
Right. That's
Yes.
right.
Thank you so much.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.